The most dangerous thing happening to your body right now is probably not a virus, not a toxin, and not a genetic defect. It is stress. And if you are like most people alive today, you are experiencing it chronically, every single day, in ways your body was never designed to handle. Chronic stress is linked to 6 of the 10 leading causes of death in the modern world: heart disease, cancer, stroke, diabetes, lung disease, and accidents. We are about to go inside every major organ in your body, in full 3-dimensional anatomy, to show you precisely what chronic stress is doing to you. By the time this video ends, you will understand your own stress response at the molecular level, and you will never think about stress the same way again. Every stress response begins in the same place, a small almond-shaped structure deep in your brain called the amygdala. The amygdala receives sensory information and makes an instantaneous threat assessment, faster than conscious thought, faster than any other brain process. The moment the amygdala fires, it immediately signals the hypothalamus, which activates 2 parallel stress response systems simultaneously. The first system, the sympatho-adrenal axis, fires within seconds, causing your adrenal glands to release a surge of adrenaline into the bloodstream. Adrenaline hits every organ within seconds. Heart rate spikes, blood pressure surges, pupils dilate, and digestion halts completely. Minutes later, the second system activates, the HPA axis, producing cortisol, the sustained stress hormone that reshapes your entire body's priorities. Cortisol is not simply a stress molecule. It is a master metabolic regulator that fundamentally changes how every tissue in your body operates. In the short term, this stress response is life-saving. But when it never fully switches off, the same mechanisms that protect you begin destroying you. Your cardiovascular system bears the heaviest burden of chronic stress, and the damage accumulates silently for years before a crisis occurs. Chronic stress keeps your heart rate elevated and your blood pressure raised, forcing your heart to pump harder than it should, day after day, year after year. Cortisol causes the liver to flood the bloodstream with glucose and triglycerides, and these elevated blood fats directly accelerate plaque formation in your arteries. Chronic stress causes systemic inflammation throughout the arterial walls, destabilizing existing plaques and making them vulnerable to rupture. Stress hormones make your blood more likely to clot by increasing platelet aggregation and activating clotting factors, dramatically raising the risk of heart attack and stroke. Takotsubo syndrome, also called broken heart syndrome, is a dramatic example of how severe acute stress can literally stun the heart muscle into temporary failure. People who work more than 55 hours per week have a 33% higher risk of stroke and 13% higher risk of heart disease. The cardiovascular cost of chronic overwork is measurable and real. Cortisol crosses directly into the brain, and sustained elevated cortisol is one of the most potent neurotoxins your brain will ever encounter. The hippocampus, your memory center, actually shrinks under chronic stress. Studies show measurable volume reduction after sustained periods of high cortisol. Chronic stress impairs prefrontal cortex function, reducing your ability to think clearly, make good decisions, and regulate your own emotional responses. Meanwhile, the amygdala under chronic stress grows larger and more reactive, making you progressively more anxious, more fearful, and more emotionally volatile. Your gut is exquisitely sensitive to stress. The stress response immediately disrupts gut motility, alters the microbiome, and increases intestinal permeability. Stress dramatically alters the gut microbiome composition within days, reducing beneficial bacteria and allowing harmful species to proliferate. Paradoxically, while stress activates the immune system initially, chronic stress progressively suppresses immune function, making you more vulnerable to infections and less capable of fighting cancer. Chronic stress accelerates cellular aging, measurably shortening telomeres faster than normal, adding years of biological aging for every year of sustained psychological stress. Chronic stress disrupts virtually every hormonal system in your body, creating cascading imbalances that affect how you look, feel, and function. Cortisol suppresses thyroid function, slowing metabolism and contributing to weight gain, fatigue, and difficulty concentrating, symptoms many people attribute to aging or lifestyle. Cortisol is catabolic. It breaks down muscle protein for fuel, which is why chronically stressed people often lose muscle mass despite regular exercise. Stress accelerates skin aging. Cortisol reduces collagen production and impairs the skin barrier, causing increased wrinkles, slower wound healing, and worsening inflammatory skin conditions. Chronic stress profoundly suppresses reproductive function in both men and women through direct inhibition of the reproductive hormone axis. Hair loss, a common stress symptom, occurs when cortisol pushes hair follicles prematurely into their resting phase, causing diffuse shedding weeks after a stressful event. Even your bones are affected. Cortisol inhibits bone formation by suppressing osteoblast activity while promoting osteoclast-driven bone resorption, increasing fracture risk over time. What stress does inside your body is the first step. And now we explore what the science shows actually reverses this damage. Slow diaphragmatic breathing is the fastest physiological intervention that exists, activating the vagus nerve and shifting your nervous system from sympathetic to parasympathetic within minutes. Exercise remains the most powerful chronic stress antidote. It burns off circulating stress hormones, reduces amygdala reactivity, and stimulates neuroplastic brain repair. Sleep is when your body conducts its primary cortisol recovery. Cortisol naturally reaches its lowest point in the early hours of sleep, and chronic sleep loss keeps cortisol permanently elevated. Social connection is one of the most powerful biological buffers against stress. Oxytocin released during positive social interaction directly suppresses cortisol and inflammation. Mindfulness meditation has been shown in clinical trials to measurably reduce cortisol levels, shrink amygdala volume, and thicken the prefrontal cortex after just 8 weeks of practice. Nature exposure, even just 20 minutes in a park or natural environment, has been shown to measurably reduce cortisol and activate parasympathetic recovery. Stress is not something that simply happens to you. It is a biological state, and your body gives you every tool you need to reverse it. Every breath, every workout, every night of quality sleep is actively reversing the damage, rebuilding the organs, the cells, and the chemistry that chronic stress has disrupted.